For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon. I'm Hillary Armstrong, a Public Information Officer with the County of Santa Clara. Thank you for joining us for today's media availability. Today we are joined by County Counsel James Williams, who will be speaking to the situation in Santa Clara County following the state's announcement that the Bay Area has been, that the regional stay-at-home order has been lifted for the entire state, including the Bay Area. Following the English and ASL portion of the press conference, we will proceed to statements from the podium in Spanish, Vietnamese, Chinese, and Tagalog. Thank you very much. And with that, I will hand it over to James Williams. Thank you.
Thank you. Good afternoon, everyone. I'm James Williams, the County Counsel for the County of Santa Clara. As you're all well aware, earlier today, the California Department of Public Health and the governor announced that the regional stay-at-home order has been lifted in all regions in the state of California. In addition, the limited stay-at-home order, which was the order that was also in effect to limit non-essential activities between the hours of 10 p.m. and 5 a.m., has also been lifted across the state with the lifting of the regional stay-at-home order. This also applies, of course, in the Bay Area and here in Santa Clara County. As a result of these changes, by and large, the County of Santa Clara and most of the Bay Area, and in fact, most of California, will return to being governed from a health order perspective by the purple tier restrictions that were previously in place under the state's blueprint. So let me take just a minute to remind folks what that means and what that's about, and then I'll talk specifically about how that translates here in Santa Clara County. But before I do that, I want to emphasize one really important critical point, and that is this. While we have made progress since the beginning of January, where we really had a peak in hospitalizations and cases, we are still nowhere near out of the woods. We still have a much higher level of hospitalizations and cases here in Santa Clara County than we did going into the Thanksgiving break, and indeed than we did several weeks thereafter. We still have seriously impacted hospitals and ICU capacity here in Santa Clara County. And so no one should misunderstand what these changes at the state level mean here in Santa Clara County and indeed around the state and in Southern California, where the situation is frankly even more concerning. And this is also true in the context of new variants that we're seeing around the world, but also showing up in Southern California and here in Santa Clara County. And so this is not a time for our community to be less vigilant. The state's actions are a reflection of some lessening from the peak. But again, our hospitalizations are way, way, way up here. And it is absolutely critical that as a community we continue to be careful and cautious, follow the public health orders, but exercise good judgment and common sense, and continue to avoid activities that are unnecessary. That being said, we are now under the purple tier level of restrictions, and so that means for this county that a couple categories of activities are allowed to once again resume. Probably the most significant is outdoor dining and personal care services. That's hair and nails and other services that are allowed to resume both indoors and outdoors. There are a number of other changes as well that come with being back in the purple tier. Specifically, the family entertainment centers are allowed to be open outdoors, card rooms are allowed to be open outdoors, and gatherings, which were prohibited completely under the regional stay-at-home order except for First Amendment purposes. Once again, up to 3 households can gather outdoors only for other purposes. There are a number of more minor changes, and our website is in the process of being fully updated with all of the revisions to the various directives to reflect the fact that we're back in the purple tier. Now, in Santa Clara County, there were some important local directives that were in place to help keep us safer that predated the regional stay-at-home order and that continue to apply here. The most significant is the travel directive related to travel and the need to quarantine if you've traveled from more than 150 miles out of the county. That directive, again, predated the regional stay-at-home order, and it remains in place even now. In fact, this may be even more critical now given the lifting of the regional stay-at-home order, given the variants that we're seeing around the world and in Southern California, and the need to try to slow the spread while we continue to ramp up, push out, and focus on vaccinating as many of our vulnerable population as possible. In addition to that travel directive, along with it is the directive related to lodging facilities that remains in place. And then some of our more specific rules, the baseline rules that you're all familiar with by now that have been in place for some time, the social distancing protocols, the requirements that go along with that, the required reporting to the Public Health Department of cases, all those rules remain in effect just as they have for many months. And our expectations that all of us in the community should have entering into any business or work site. If you're an employee, those are expectations you should have of your employer. If you're a patron customer, those are expectations that you should have of any place that you go visit. And those baseline rules remain unchanged and really form the core of our safeguards here in our community. I want to conclude just by, again, going back to that broader point. It is indeed good that we've come down a bit from that peak, but the level of hospitalizations that we're at is not something that is sustainable on an ongoing basis. And the state's actions, the state itself described, are based on forecasts of continued improvement over the next several weeks. Well, those forecasts are predicated on people's continued behavior, people continuing to be vigilant, people not gathering. For example, people not letting their guard down. And so it's all the more important in our community that we continue to make that progress, that we continue to see cases come down, that we continue to decompress our hospitals, we continue to save lives as we are in this very pivotal moment where vaccinations are just beginning to really ramp up, where we're eagerly awaiting additional supply from the federal and state government. This is such a pivotal moment that we want to move forward together as an entire community with all of our friends and all of our family. And the best way for us to do that is to hang tight, stick together in that effort, and really follow carefully, thoughtfully, consistently the basic precautions and rules that we all know so well by now, from face coverings to avoiding non-essential activities and maintaining social distancing. And with that, I'm open for questions.
Sorry, Mark, right in. Jeff, thanks for always doing this. Early on the Sound Mercury News, I always come to you on these things to ask sports questions that you know. So there's a ton based on this. We're trying to unravel it ourselves. The first one is the professional and college sports. What needs to be done so they can continue competing and practicing in the council?
Yeah, so the question was about professional and college sports, and that is one of the directives that's changed today as well. So collegiate and professional sports can resume in Santa Clara County, again without audiences, but can resume in Santa Clara County consistent with that directive. The directive requires across the board testing and also requires that each of these teams ensure that their athletes and that their personnel are limiting any exposure to the broader community and basically keeping within their households or participating in their activities, because close contact sports, obviously there's not social distancing. So we have a revised directive up around that, and those activities can now resume with the lifting of this regional stay-at-home order.
Can I ask a follow-up, please? Because based on that about contact sports, high school and youth sports, I'm hearing from thousands of parents, if you can imagine. I'm sure you're hearing from more. So what about, where do they stand in all this? Can high school start up right now?
So youth and adult recreational sports and other forms of youth sports that are not contact sports, in other words, where you can maintain social distancing, where they are being conducted outdoors, and where you have a stable cohort, those can resume. But not where there is close contact, and not if the activity is indoors. And-
James, just a clarification, it's a little muffled. You did say outdoor dining is back.
That is correct. Outdoor dining can now resume.
And then, just finally, every other press conference we've mentioned has been so grim. This feels actually pretty positive. Can you say to the public that what they've been doing the last couple months has actually worked? Is this a result of us staying home and locking down so tightly for the last couple months?
So the question was, can we say that, this has been a result of what people have done? And that's certainly true. So we have definitely seen cases and hospitalizations come down the last few weeks. And we definitely have seen that there was less travel and activity over the Christmas and New Year holiday period than over Thanksgiving. And there's no question, I think, at this point that you can assess, if you look at our epidemiological curve of the cases and hospitalizations, that the surge that came out of Thanksgiving was not repeated coming out of Christmas and New Year's and the December holidays. And that's a really good thing, and that's absolutely a reflection of the fact that I think people took what happened in November as a wake-up call, and I think it's also a reflection of the fact that these measures were taken in December. The stay-at-home order, things like the travel directive going in place after Thanksgiving. I think people recognizing that this is really a driver of transmission and something that needs to be taken very, very seriously. That being said, it's really important to recognize we're just on the downslope, right? We have a ways to go to get back to anywhere near the levels we were at in October and middle of November. And we need to get back down to those levels in order to be in a much safer place as a community, to avoid many, many deaths and serious illnesses, in order to avoid the secondary impacts on our hospitals. And so what people have been doing has been working, and we need people to continue to do that so that those cases and hospitalizations continue to come down, and we can be in a much better place altogether as a community.
Can
ABC?
you touched on it briefly, but can you just elaborate why the county opted to keep the travel quarantine in effect? Is it working, or what is the thought behind that?
Sure. So the question is, why is the county keeping the travel directive in effect? And there are a couple of important reasons for that. One is with the lifting of the regional order across the entire state, and given the fact that Southern California has such a significantly increased case rate, positivity rate, and also that we know that there are variants circulating, the so-called UK B117 variant, for example, has been detected in Southern California. That's all one reason that it's very important for people to quarantine when they travel. A second reason is that the travel directive appears to have really had an impact on the volume of travel that occurred after it was put in place, and we know that travel is one significant source of spread. So both those reasons coming together are reasons that we're keeping that important directive in place. But especially right now when our focus is on vaccination, there's different variants circulating, there's a lot of spread out there, and there are a lot of places that have even much higher levels of COVID than we do here in Santa Clara County.
Mr. Williams, as I understand it, the county has suspended all deliveries of vaccine to Good Samaritan Hospital after it was apparently vaccinating teachers and school district staff in Los Gatos inappropriately, apparently, according to the county. First of all, what is the county's position on what happened there?
Sure. So the question is, what's the county's position on what happened at Good Samaritan Hospital with respect to vaccination of Los Gatos School District teachers and staff? We became aware of this email that had gone out basically saying there was this special deal for vaccination. There were a lot of factors there that were very concerning to us, as reflected in the letter that we sent the hospital. One of those factors was the fact that the hospital itself had said that it was only in a position to be vaccinating healthcare workers and hadn't done the outreach to the priority 75 and older tier. Another concerning factor was that it appeared that they were reaching out to the specific district based on the way it was framed anyway, based on meals and other things provided to Good Samaritan staff as opposed to districts more generally. A third concerning factor was that they appeared to be affirmatively suggesting that staff should sign up registering themselves as if they were healthcare workers. Those were all things, among others, that we outlined in the letter as things of concern and not consistent with our expectations for vaccine providers in the community. So we will be in continued conversation with them, but at this time, we're not in a position where we would provide any additional county allocations to Good Sam, given what occurred.
The hospital says that they were only administering 65 doses that had been thought out and they were looking to use them. On the other hand, later that night, the school district was telling its employees that well, you can start signing up, and over the course of the next day and through the week, people were going to be getting this. Do you buy the explanation that it was just getting rid of 65 doses that day?
Well, the question was, do we buy their explanation about it being potentially wastage? We saw the same email that I think all of you saw, and our concerns expressed in the letter were based on the content of that actual document that was being distributed and circulated, which doesn't appear related to wastage.
And when somebody signs that document, are they doing so under perjury? What is the legal significance of saying I'm a healthcare worker?
Yeah, when people come for vaccinations, the question is, what's the legal significance when you go and sign up? We're not requiring, for example, in the county's own health system, and I don't believe any other health systems are requiring any extensive documentation, but we are requiring people to attest. That means under penalty of perjury to affirm their eligibility. And that system relies on people being truthful. That's why perjury is a crime, and that's how the system is kind of designed. And so, yes, it's very concerning if someone's suggesting that people should affirmatively select a different category that's not what actually represents who they are.
Spotlight. Considering that the last time that county went under, let's say, shelter in place orders, it's because the county just under 50% ICU capacity, and considering that just over the weekend, the county reported about, I believe, an 8% capacity in ICU. But what was the justification for coming out of the shelter in place when the capacity of the ICUs was still low?
So the question is, what's the justification for the regional stay-at-home order being lifted when, for example, in Santa Clara County, by the way, much like many counties in Southern California and elsewhere, ICU capacity is at or below the 15% right now? I think that's a question that you really should ask the State Department of Public Health. There are many counties in Southern California that continue to have seriously affected hospitals. And so that's something that we're very concerned about. But they have done projections based on their models as described, I think, at today's state press conference, where they believe that all the regions are headed out of that danger zone.
You had said that the lodging directive was one
Sure. So the question was related to the lodging directive, which kind of goes hand in glove with the travel directive remaining in place. That directive has to do with limiting bookings at lodging facilities to only essential travel. And the travel directive, of course, strongly discourages any non-essential travel and puts the quarantine in place. So those two kind of fit together as part of a broader effort to discourage any non-essential travel in Santa Clara County.
Good, Mercury News.
Thanks again. As it stands at this moment, the San Jose Sharks have their first two home games in the Phoenix area, February 1st and February 8th. Can they now play those games in SAP Center?
So the question is, can the Sharks now play at SAP Center? And the answer is, if they're adhering to the new directive, yes, they could.
Good, ABC.
James, there's some concerns that this new variant could wipe out any progress that we're making in the state. How closely are you watching this? And do you have a team behind it? How are you doing that?
So the question is about the new variant and could it affect the progress here in California? And there's actually at least 3 variants that are being closely monitored by us and I know by the state, and there are probably others as well. There's the so-called UK variant, the B117 variant, that studies appear to suggest is more transmissible and concerningly potentially more fatal, is the latest news that's coming out of the United Kingdom related to it. There's a so-called South Africa variant, and there's studies ongoing about its impact on vaccination. And then there's a variant that we found here in Santa Clara County and that elsewhere across the state, the L452R variant, where there's a lot that still is under research. The bottom line, I think, for all of these is there's a lot we don't know, including their exact impacts. Some of these variants definitely appear to be more transmissible, meaning that the virus spreads more easily, more people get sick. And that's very concerning for sure. And potentially that there could be other impacts from them. It's something that we know the CDC and the State Department of Public Health are closely looking at. We actually do a lot of genetic sequencing here in Santa Clara County, a disproportionate amount compared to other places in California, which is one of the reasons we found information around the L452R variant, because it's something that our public health department and our public health lab has been concerned about and interested in paying attention to. So we're definitely monitoring all that, but we really don't know a lot of what it's going to shape up to be. What we do know right now is that it's a very good reason to be all the more vigilant. And the one concrete thing that we can do right here, right now, about these variants that are circulating is to double down on being really strict about following the public health guidance and to also avoid travel, because that helps be the engine for the spread of these variants.
James, you're not going to tell people to don't wear masks like we've been hearing in some other places?
We don't have specific additional recommendations at this time related to masking or other things, but it's definitely critical for people to, at a minimum, be following the current public health directives.
NBC.
Can you give us a sense of how many people in the county have been vaccinated so far and what you're doing to make sure more people can get vaccinated? Are you getting enough supply?
So questions about vaccination and what are we doing to expand access. I don't have the specific numbers with me because I was focused on the health orders, and we'll definitely have, we have dashboards and so forth related to the vaccination. So I don't have the specific numbers up to date on vaccination. What I can tell you though right now about it is we continue to expand our capacity to deliver vaccinations. We have mass vaccination sites that are open and open for scheduling at Burger Drive and the fairgrounds. That's from the county health system itself. That Kaiser, Palo Alto Medical Foundation, Stanford Healthcare, and others are also standing up significant vaccination capacity, and links to all of that information is available at sccfreevax.org, and people can schedule appointments. And we have appointments that are available. So it looks in the systems that there is some available capacity for people who are eligible, which again is healthcare workers and people 75 and older, individuals 75 and older. So we encourage all of those folks to get a vaccine and get it quickly. We're going to continue to ramp up capacity. So a lot of work is happening with the county's own health system, and we know that's happening in other health systems that serve county residents to ramp up capacity. The big limiting factor remains vaccine supply. And we haven't seen an increase in supply coming in. We are hopeful with the statements from President Biden, with the Biden administration's new plans, to see how that translates on the ground. We know it'll take a little time, but they clearly have this as one of their core missions. And so I'm sure that there will be changes coming that will be very concrete. We just don't know yet how that's going to translate here on the ground. And we also expect that there'll be more changes coming at the state level.
So final question from the spotlight?
Yes. In terms of enforcement, like what is the county doing to ensure that these directives are being enforced?
So questions around enforcement. So as I think many of you know, we do have an enforcement and compliance team. It does take an education first approach. But if people have issues, they can go to the portal, seccovidconcerns.org, and fill out a form on that portal. It's a web portal, and those are all looked into by our enforcement team. We do have enforcement officers that go out and look into compliance. And if necessary, they do issue fines, and we do follow up on those. We take these very seriously. These are health and safety rules, right? This is about serious illness. This is about preventing death. And so it really ranks high up there with some of the most important rules that we have as a society that we follow to keep each other safe. And so we certainly take it seriously. We have a unit. We focus. We prioritize. Resources are limited, but it is something that we want to make sure, first and foremost, that the businesses that are operating in our county, all the other entities operating in our county are doing so in a manner that's safe and protective of their employees and of their customers.
Thank you, everyone. We'll now go to the Spanish portion of the media availability.
Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.